Most people with this STI don't even know they have it until permanent damage begins. They walk around feeling completely healthy, going to work, dating, and living their lives, completely unaware that a quiet invader is systematically altering their body from the inside out. And by the end of this video, you'll understand the warning signs doctors say people miss the most. We live in an age where we think we know our bodies perfectly. We track our steps, we monitor our sleep, and we Google every minor headache. But what if the most dangerous threat to your health is something you can't see, feel, or even detect without a specific test? There is a hidden epidemic quietly spreading among adults ages 18 to 34. And the scariest part isn't the symptoms themselves. It's the complete lack of them. Medical experts refer to these as silent infections. It sounds like a plot from a medical thriller, but it's a reality for millions. Chlamydia and gonorrhea, for instance, are notoriously stealthy. Up to 80% of women and 50% of men who contract chlamydia show zero initial signs. Later in this video, we will reveal a specific, seemingly harmless skin change that most adults completely dismiss, but is actually a major red flag for a systemic infection. For now, you need to understand how this silence tricks your brain into a false sense of security. When symptoms do decide to show up, they are masters of disguise. They don't look like a textbook illness. They look like everyday annoyances. You might wake up with a mild, dull ache in your lower abdomen and assume you just ate something wrong, or that you strained a muscle at the gym. For men, it might be a fleeting, mild burning sensation during their morning bathroom routine. It happens once, maybe twice, and then vanishes for days. You think, oh, I must just be dehydrated. But that temporary discomfort is actually the virus or bacteria establishing its foothold. In women, the signs are even easier to misinterpret. A slight change in normal discharge or subtle spotting between periods is often brushed off as hormonal fluctuations, stress, or a regular yeast infection. But here is the critical warning sign that should never be ignored: deep pelvic pain during intimacy. This isn't just discomfort. It is a loud distress signal from your reproductive system that an infection is causing deep-seated inflammation. So, how does a quiet infection travel so fast? It all comes down to how these pathogens spread and the myths we choose to believe. The transmission is seamless, often happening during encounters where both partners genuinely believe they are completely clean. One of the biggest misconceptions driving this rise in cases is the idea that you can only catch or pass an STI if you have fluid exchange or penetrative intimacy. The reality is much more complex. Skin-to-skin contact in the genital area is more than enough to transmit infections like HPV or herpes, even when using protection perfectly. And here's a surprising fact that catches many adults off guard. Oral transmission is incredibly common and highly efficient. Many people don't realize that a standard throat infection can actually be gonorrheal, causing a mild sore throat that you'd easily mistake for a common cold or seasonal allergies. Let's look at a realistic scenario. Imagine Sarah and Mark. They've been seeing each other for a few months. They had the conversation. Both claimed they were clean because their last routine blood test at a regular checkup came back fine. What they didn't realize is that standard physicals rarely include specific STI screenings unless you explicitly ask for them. A month later, Sarah starts experiencing mild fatigue and a slight pelvic heaviness. She blames her busy work schedule and buys a heating pad. Mark notices absolutely nothing. Because Sarah ignored the subtle signs, the bacteria continued its journey upward. This exact scenario plays out thousands of times every single day, purely because we are conditioned to believe that no pain means no problem. This brings us to the dangerous myths that keep people from getting checked. The most pervasive myth is that you can judge a partner's health by their appearance or their background. People think, they look clean, they come from a good family, they care about their health. But microscopic organisms don't care about someone's lifestyle, aesthetics, or personality. Another dangerous misunderstanding is the belief that if you had an STI once and took antibiotics, you are now immune. It doesn't work like that. You can be reinfected immediately if your partner hasn't been treated simultaneously, creating a vicious cycle of damage. And the consequences of letting that cycle continue are severe. When left untreated, a silent infection doesn't just go away on its own, it escalates. For women, a neglected chlamydia or gonorrhea infection can develop into pelvic inflammatory disease, or PID. This causes permanent scarring in the fallopian tubes, which is one of the leading preventable causes of infertility and ectopic pregnancies. For men, it can lead to epididymitis, a painful condition that can compromise fertility. Beyond that, having an untreated, inflamed reproductive tract makes it significantly easier to contract or transmit other serious infections, including HIV. The emotional weight of discovering you have permanent fertility issues from an infection you could have cured with a simple bottle of pills years ago is devastating. The good news is that preventing this trajectory is entirely within your control. Protection is a powerful shield, but open communication and a shift in how we view healthcare are even more critical. Regular testing needs to become as normalized as going to the dentist. If you are sexually active, getting screened at least once a year, or with every new partner, is the only definitive way to know your status. It takes less than 15 minutes, and it completely removes the guesswork. If a test does come back positive, remember that modern medicine makes handling this incredibly straightforward. Bacterial STIs are completely curable with a short course of standard antibiotics. Viral infections, while lifelong, are highly manageable with modern medications that reduce viral loads to levels where they don't impact your daily life or your long-term health. Finding out isn't a life sentence. It's the first step to protecting your future. Your health matters more than embarrassment. If this video helped you understand your body better, please subscribe for more medically accurate health breakdowns. Stay safe, stay informed, and take care of yourself.